Good evening, everyone, and a warm welcome. Just wait a few seconds to make sure everyone is in. So just want to say good afternoon to everyone and a warm welcome, and welcome to our Early Years in Mind webinar, bringing fathers into focus. My name is, next slide, please. Thank you. My name is Nana Osu, and I'm the Head of Clinical Services here at Anna Freud. And it's a real pleasure to be with you all this afternoon for what we know is going to be a deeply important and timely discussion about fathers, families, and systems that support them in those early years and stages of life. Before we continue, I just need to go through a few housekeeping, and then we'll get into the crux of what we're going to be doing today in today's webinar. So please note that your video and microphone will be switched off for the duration of the event. This webinar will be recorded and will be available to watch on our YouTube channel post-event. We will have closed captions on for this webinar. If you would like to turn these on, please select the closed caption button on your toolbar. Please submit any questions you have via the Q&A feature. That you should be able to see that at the bottom of your Zoom page. So we will have time for questions and answers towards the end of the webinar. So please do post any questions, and we'll try and answer as many as we can when we get to the end of the panel discussion. If you find any of the sessions triggering and any of the discussions triggering, please do feel free to leave the event at any time. However, there will be a link posted into the chat where you can find resources for support. It's really important that you access any support you might need. And at this point, I will say that part of the webinar does include a video that does have some triggering scenes in the video. So just to bear in mind and keep an eye out for the link as we get to that point. Next slide, please. You will get these slides post the event as well, but we just wanted to highlight that at Anna Freud, diversity and inclusivity and equity is very important, and we strive to ensure that there's better representation of diverse voices and stakeholders. And you'll see that through today's webinar. And I just want to also share, for anyone, it's your first time joining one of these webinars, just to share with you that our Early Years in Mind series is a free national online network for early years practitioners developed by Anna Freud Center. And it offers evidence-based guidance, resources, and tools that help early years professionals support babies, young children, and families' social and emotional well-being. Next slide, please. So today we're going to be talking about, as we shared in the beginning, is about bringing fathers into focus and talking about paternal mental health. And we've got a great panel ahead of us. We've got Dr. Sharin Baldwin, who will soon be coming on to share her research that is based on the film that we'll be sharing later. And then we have Chris, who they will all introduce themselves, but I'm just going to go through briefly and quickly. We have Chris, who is the film producer and director, and we have two of our parent champions, Dylan and Andy, who will introduce themselves, and Dr. Dickon Beverton, who is our medical director here at Anna Freud. Next slide, please. I'm going to hand over to Sharon to share a bit about the research that has informed the film we will share and have a panel discussion based on. And what we hope for today is that you'll hear a bit about the research that informed the film, and it's really focusing on fathers' role and how ensuring that they are not invisible, and thinking of yourselves as practitioners, how you go about that. And also during the panel discussion, we'll hear some conversations, and hopefully you'll be able to take away some practical thoughts and skills and practical guides about how you do this in practice. Just going to hand over to Sharon now.
Thank you, Nana. I will just start that. Great. Well, thank you very much for having me today. I'm really excited to be here to talk about fathers' mental health, because this is a topic that's been close to my heart for many years now. and it's been an area that I've been researching for quite some time. Now, I often get asked, why fathers' mental health? Why did I decide to focus on this topic? So I just wanted to share some of that with you, just so you get an understanding of why I got involved in this area and how the research came about. So for me, it's both professional and personal reasons why I decided to focus on fathers' mental health. I trained as a nurse back in, I qualified in 1998. After working as a nurse for a few years, I then decided to train as a midwife. And as a midwife, I predominantly worked with mothers and babies. I did come across fathers, often in the delivery suite and after the birth. But in terms of providing support or care to fathers, we rarely did anything. Then a few years later, I went on to train as a health visitor. Now, as a health visitor, those of you who know, you'll know that health visitors work with the whole family. Every family with a newborn baby has a health visitor. So I thought, okay, now in this role, I will be working with the whole family. But what I found in practice, I was still working with mothers and babies. Often when I did home visits, fathers would excuse themselves and leave the room and say, I'll leave you to it. And yeah, in terms of providing support, again, we were not providing any support for fathers. I then went on to train as a perinatal and infant mental health champion with the Institute of Health Visiting. And as part of that role, I was delivering training to professionals around perinatal mental health. So I trained GPs, social workers, early years workers, as well as health visiting teams and midwives. And again, what I found was that when we were talking about perinatal mental health and the impact on children, we just focused on the mother. Fathers were not really talked about. So everything that I was doing in my professional practice was focused on mothers and babies. And then in my personal life, I became a parent for the first time about, well, nearly 18 months ago, because my daughter's going to be 18 next month. And at the time, this is what you saw. Leaflets that were focused around mothers and babies, services for mothers and babies, and fathers were rarely mentioned. Now, the sad thing is that not much has changed in 18 years, because when you look at research, fathers are still feeling marginalized. So according to research, men still feel that they're being ignored by midwives, health visitors don't involve them, child and health services are mainly women and child focused. They feel that health visiting is a service provided by women for women, and then the information that's available is written from the woman's perspective, so it doesn't really take account of fathers. So there wasn't just a service gap, there was also a research gap when it came to fathers, because what we were finding was that health policies talked about engaging fathers and providing better support to fathers, but we didn't have enough research around fathers' experiences during their transition to fatherhood. And until we know what those experiences are and what their needs are, we can't really provide effective services. And that's the reason why I decided to research first-time fathers' mental health and well-being. And what I wanted to do is really try and capture their experiences during that transition and look at their support needs. Now, just to talk a little bit about why fathers' mental health is important. Well, we know that the promotion of mental well-being and the prevention of mental ill health is a priority. We know that poor mental health accounts for nearly 25% of all ill health in the UK, and that's likely to double over the next 10 years. And a report by the London School of Economics showed that the cost related to perinatal mental health in women is around 8.1 billion per year in the UK. Now, we don't know the exact cost relating to fathers' mental health, but what we do know is when men become fathers, they go through a number of different changes. And for some men, this can be very difficult. We know that up to 10% of fathers suffer from depression during this transition, and many more will experience anxiety. Usually see the figure around 18%. And poor mental health in fathers not only affects their own health, but has a huge impact on the relationship with their partner, and it can have a negative impact on their child's cognitive, behavioural, social and emotional development. So I would say that addressing fathers' mental health is a public health issue that we need to tackle. This led to my research where I carried out the New Dad study. And this was a 3-part mixed method study, really focusing on men's transition to fatherhood. And what I found was through the 3 different studies, men talked about various experiences during that time. And what was clear is that this transition involves significant psychological and emotional shifts. And in my study, fathers talked about the formation of a new fatherhood identity when they became dads. They felt more responsible. They felt they had to be strong and provide for their family. They also talked about the competing challenges of balancing the role of fatherhood with work life, as well as, being tired and exhausted all the time. And they talked about the negative feelings related to fatherhood, where they worried about being a good enough father and being able to provide for their family. And it was these 3 main factors that affected their mental health and well-being. And fathers often have expectations around what kind of father they will be and what fatherhood will be like. And when they're faced with reality, sometimes it can bring about unanticipated stress, and that can increase their vulnerability. And these changes can lead to parental dissatisfaction and then potential perinatal mental health difficulties. So it was during this time when I was carrying out this study that I met Chris. As Nana mentioned, Chris Godwin is the founder and creative director of Inner Eye Productions. And what Chris does is he brings about a unique approach to culture change through the powerful medium of film. And when I met Chris, he had made another film at the time called Beyond Baby Blue. And this focused on a young mother's experience of postnatal depression. And this film was just so powerful that it stayed with me for quite some time. And it really got me to think about my own practice. So I decided to incorporate that film into all the training I was delivering at the time. So although we talked about making the film while I was doing this study, we didn't take it forward then. And then Chris and I got in touch again about 2 years ago, and we started talking about making this film. And it was a really good time because I was about to start my new post with the Institute of Health Visiting as their research lead. So we felt this was a great time to come together and work on this film together. And we were fortunate to get funding from the Burdett Trust for Nursing. And that's how our film Invisible came about. Now, I'm not going to tell you too much about the film now because you will be seeing the film soon. But just to say a little bit about film and why we decided to go down this route. Now, film is increasingly recognised as a powerful tool for bridging the gap between research and practice, because film can reach us emotionally in a way that words alone can't. And there's now more evidence to suggest that film can support the kind of engagement and reflective learning that promotes long-lasting change. So we believe that Invisible is a catalyst for change. We've had over 9,000 views now. And what I want to do is share some of the feedback that we've had from people who've viewed the film so far. So we've had feedback from practitioners as well as parents. And these, we will send out the slides to you so you'll get to see the feedback in more detail. But just to give you an overview in terms of the impact for some people, it's really made them reflect on their own experience of parenthood. It's highlighted the importance of this issue that's rarely talked about. And for some, they didn't realize that fathers were actually affected by depression and that it affected 1 in 10 fathers. When we asked people to comment on how it's changed the way they think about fatherhood and mental health, They've said how it's given them insight into depression and how that might manifest in men. And they are now more aware of the importance of routinely asking fathers about their mental health. And people have talked about how they're planning to use the film going forward. So they're going to use it for self-reflection, to inform their practice, sharing it with colleagues. But as well as that, some are planning to use it with parents in fathers groups to raise awareness. So far we have disseminated the film widely. We launched the film on International Fathers Mental Health Day, which was on 16th of June this year. We have created some briefing notes to go along with the film, so that if you're planning to use the film, you can use the briefing notes, which has a range of different resources available. And we will be sharing those links with you in the chat soon. And we would also like to invite you to give us feedback after you watch the film, because we're planning to evaluate it. And once you receive the link for the briefing notes, you will also find a QR code there where you can leave us feedback. So far, in terms of disseminating the film, we have presented it in various conferences. There was a conference in Vienna recently. We are due to present in Australia later on this year as well. And currently we have a paper being peer reviewed for publication. So I hope you find the film useful, and please do leave us feedback once you receive the link. And I will be around later on to take any questions that you may have. Thank you.
Thank you so much, Sharon, for that. And I mean, I've heard the presentation before, but just going through it again and listening again, I think it's fascinating just hearing your personal journey and just thinking about research. And it's around bringing research alive and into practice. And we're just about to go in to watch the film. And I just urge everyone listening in just to some of the points that Sharon raised in the highlights from the research. And I personally found it quite fascinating and interesting that some of the key themes that fathers shared around their challenges mirrors what new mothers may experience. And as professionals, or even as mothers, I'm a mother myself, you don't actually think about that at times. So I think there were some key poignant points that came out in what Sharon you just shared. So I just want the audience and participants to hold that in mind as we go in to watch the film. But I do want to emphasize there are some scenes in the film that might be and are quite triggering. So just that self-care message, and please refer to the link in the chat.
Oh, it's okay. It's okay. Are you still hungry? Oh, Mommy's here. It's okay. It's okay. There we go. Take this. You're so gorgeous. Can you take this, please?
Coffee.
Oh, thanks. Just leave that there.
I'm all right, thanks. Don't let him have a bit of fresh air.
Hey, but what if he wheezed on me like last time?
Oh, that's true.
Oh, he's good.
We'll be out your hair soon, Lorraine.
Oh, stay as long as you like. There's no rush. No rush at all.
Well, I appreciate that, but we should be good to move out in the next few weeks.
Next few weeks?
Well, yeah, we can't stay here forever, can we? It's not fair on your mum.
Josh is only 2 weeks old. Where are you going to get the money?
Don't worry, I'll sort it.
Such a good little boy.
Oh, I'll get that.
Mummy's just gone to see who's at the door.
Hi, are you doing?
Yes, are you Jules?
Yes, hi.
Thank you.
Oh, is it shoes off? Oh, no, don't worry. Come through.
Hi.
So this is my mum, Lorraine.
Hello.
It's nice to meet you.
Nice to meet you.
Oh, I kept your seat warm.
Oh, thank you.
And this is my partner, Luke.
Hi, Luke.
Hi.
Nice to meet you. Oh, what's your name?
This is Josh, or Joshua.
Hi, Josh. Oh, that's lovely. Congratulations, he's gorgeous.
Thank you.
So, how are things?
Good, yeah, generally good. Got quite a lot of questions, but generally good.
Okay. I can see that you had a vaginal birth. Did everything go according to plan?
Not quite.
Okay. Could you tell me a bit more about it?
Look, it was fine. Just the labour seemed to go on forever. Don't get me wrong, midwife was amazing.
And how did the actual birth go?
The birth, well, he gave us a little bit of a surprise.
Is he breathing? Is he breathing? He's not breathing. He's not breathing. He's not breathing.
What's going? What's wrong?
I don't know.
Luke,
I don't know.
Luke, what's wrong? Tell me what's wrong.
I don't know. I don't know. What's going on? What's going on?
So, have you been feeling nervous, anxious, or on edge over the past 2 weeks? Thank you.
No.
Last question. Have you been worrying a lot recently?
No.
Okay, great. Luke, everything okay with you?
Yeah, fine.
Sorry. Anyway, I think we're almost done here. So here's your red book. And then just remember to book him in with a GP practice and also book in his immunisations with a practice nurse.
I will do. Thank you. I'll show you out.
Oh, it's okay. I'll take you. Let's go and see what Grandma's doing, shall we?
Luke! Hey, we've missed you. Okay, let's get it over with. Show us the photo. Boy or girl?
Boy. Josh. Well, Joshua, but we call him Josh.
Well, as far as babies go, he's pretty cute. Are you sure you're the father?
Yeah. Best day of my life.
So you wanted to see me? Don't tell me. You need more time off.
No, I was actually wondering if I can get some more shifts.
More shifts?
Yeah, I could do with the extra cash.
Well, leave it with me. I'll see what I can do. Anything else?
When do you reckon you can get back to us on it?
Well, when I've looked into it.
Nice one, Jerry. What about this one? What do you think?
Why do you keep showing me this stuff?
Well, you want to move out, don't you?
Yeah, but not now.
Well, we can't keep sponging off your mum.
We're not sponging. She's happy for us to stay.
Yeah, but for how long?
As long as we need to.
How long's that, Jules? 2 weeks? 2 months? 2 years?
Why are you being like this? And as far as I'm concerned, we're broke anyway.
We're not broke. Anyway, I'm going to be starting some new shifts soon.
Oh, really?
Yeah, really. Look, Jules, I'm going to sort the money.
Pick him up.
What?
Pick him up. He's your son.
He's fine.
Why won't you pick him up?
Because he's fine. Stop worrying.
Hi, yeah, it's Luke, Jerry. I'm sorry to leave you another message, but I just wondered if there's any news on those shifts we talked about. Yeah, I heard you got a new shop fit as well, and I'd be really keen to help with that. All right, just give us a call as soon as you can.
Jerry, it's been 3 weeks now, and you've still not got back to us. Just get back to us as soon as you get this message, okay?
Hi, darling.
Hi, man, you all right? Hey, fat white. Is that all right?
Yeah, thanks. How's my lovely grandson doing?
Yeah, fine.
Just fine?
Yeah, he's good.
Yeah?
Yeah, good. Yeah.
Yeah. What's up?
I need to borrow some money.
Oh, really?
Yeah, look, it's just a few £100. It's just for a rental deposit, okay?
Yeah. I'm not lending you any money.
It's not for gambling, if that's what you think.
Really?
Yeah, I'm not gambling over a year, you know that.
If that's all you wanted to see me about, then I got stuff to do. Hey?
Look, just stay. Please. Truth is, I've been struggling a bit.
Struggling? You have got a beautiful baby, a beautiful girlfriend, you got a good job. Trust me, you have nothing to complain about.
Am I like Dad?
Oh, not this again.
Am I?
No, you're not like your dad, Luke.
How can you be sure?
Okay. Yeah. Yeah, you are like your dad. Is that what you want to hear? Is it?
Yeah, maybe it is. Yeah.
Yeah. Just forget about him. He is out of our lives now.
Not now, Luke.
I just need 5 minutes.
It's not a good time.
You can't keep ignoring me.
I am not ignoring you. I'm just very busy at the moment.
Look, I need those shifts.
Can you let go of me? There are no shifts. The truth is that we're going to be cutting your shifts.
What? Why?
Word is you're not pulling your weight.
Oh, you said that? Yes. Tommy. Ah, it's Tommy, innit?
No, it's not Tommy. Look, if you want to carry on working here at all, I would suggest you back off.
Yes, boss.
What do you think?
Oh, they are so cute. Oh, I love them.
I know. And look.
Perfect. They'll go so well.
They're so little sockies.
Little stars. So cute.
And look.
That's so cute.
I know.
How many of these did you get?
I got 8. 8? Yes. Honestly, believe me, you'll get through them.
Do you think maybe something a little warmer? Oh, that's perfect. Oh my god.
Look and it's gonna look so good.
It looks so good in this.
I know. A little pocket. He could keep his spectacles in. Just a bit of tobacco in there. I know. Oh, I've got this.
Luke?
I'm so sorry.
What's going on?
What do you mean?
Hi, Dawn. Hi, how are you?
Good, thanks. How are you?
Yeah, good, thank you. I'll just go and get Josh.
Hi, Luke.
Hi, Dawn. I'm just heading home.
Oh, it'd be great if you could stay.
You don't need me.
I think we do.
Trust me, you don't.
Luke, we really need you. Jules, why don't you pass Josh to Luke?
I can't hold him.
Why can't you, Luke?
I don't know. I don't know. I just can't. I can't hold him.
Why don't you just put your finger in his hand?
I'm just going to give another reminder. If anything in the film has affected you, please remember to use the support links that have been shared in the chat. And please remember to use the question and answer function if you've got any questions that you might want to ask or any reflections that you want to share following the film and during the conversation we're just about to have. And we will have some time before the end of the webinar for some Q&A, and we'll pick up on as many questions and share any reflections if time permits. Thank you very much. So what I'm going to do now, we're just going to get into our panel discussion to ensure we can be able to unpick some of what Sharon shared in her research and the film we've just watched, want to give enough time for a panel discussion where we can unpick some of the themes and some of the thoughts, feelings that have come up, and also share as professionals how we can support fathers better and think about some of the implications for practice in some of what we've seen in the film Invisible. So what we're going to do, I'm going to introduce our amazing panel again. So we have Chris Godwin, and who's the founder and creative director of Inner Eye Productions, who was the producer and director for this amazing film Invisible. And I'll be honest with you, I always say there's nothing more powerful than a film to bring out. And I think that's what Invisible has done, brought out the voices and the unseen things that we don't see in what these fathers are experiencing. So thank you, Chris. So the next person on the panel is Dylan, who's our parent champion. Anna Freud, who's been with us for over 2 years. And then we have Andy, who's one of our new parent champions. And then we have Dr. Dickon Bevington, who's our medical director here at Anna Freud. And Sharon will also be joining the panel. If you're all ready, I'll ask you all to turn your cameras on, please. I'll just wait for everyone to come on and then we can jump into the discussion. Okay, that's fine. Going to start the discussion. First, coming to yourselves as fathers, Dylan and Andy. I've done a brief introduction, so please do introduce yourselves and also please share your reflection and thoughts about what you saw in the film that we just watched, Invisible. Dylan, you can...
Do you want me to go first?
Yeah.
So my name's Dylan, a parent champion, and I am a father of a 3, soon to be 4-year-old. And yeah, I was listening to Sharon's kind of work and thinking I can see that a lot in my personal lived experience and what I've spoken about with other fathers. And then watching the film was quite gut-wrenching. It's quite a distressing film to watch as well in some ways, but also I found what I found interesting, I suppose, was that I could see similar experiences, but he had a quite different attitude or different things that just happened for him in different ways. But it's still, I could still relate to it and still kind of understand those kind of experiences from a different perspective of I guess what it's like to be a dad in some ways. But yeah.
Thank you, Dylan. And Andy, your thoughts?
Hi everyone, my name is Andy. I'm a father of 3, a 9-year-old, a 7-year-old, and a 7-month-old. I work in education, and I'm very, very passionate about fatherhood. I genuinely want to be the best father I can be to my kids, so I do everything to get as much information as possible. That video was absolutely, as Dylan said, it was awesome. Sadly, because it genuinely spoke about things that I've experienced, and also some of the fathers that I talk to regularly. The title says invisible because unfortunately for a lot of us fathers, I'll speak for myself. I genuinely feel that we're invisible up until a point. And so to watch this video and hear that, somebody can actually hear our silent voice and create this video for us and discuss some of the things that we may have gone through. For example, some of the concepts of only being seen and not heard, the questions always to mum, 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 and partner as opposed to mum and dad. Or, your name is Sharon. Okay, what's your name? David. All right, excellent. All right, Sharon, what do you think? David, what do you think? So it was really, really interesting to see that. Very, very sad.
Thank you.
I think inclusion is necessary, and it's about feeling invited to be part of that conversation from the beginning of the process.
Thank you so much. Thank you. And I think on the points you both made, and thinking about our participants and our audience that is listening in as professionals, I just want to unpick a bit further with you both around your experience of what professional interactions during the antenatal and post-birth stage, as in your journeys, your interactions with professionals, and both the positive, if you've had good experiences of this, or if there's anything that reflects what we saw in the film Invisible. Any of you can
Yeah.
go. Yeah.
I mean, I would say similarly, kind of invisible is a great word, in that kind of seen on the sidelines a little bit would be most of my experiences with professionals going through that pregnancy and labor and birth, and then after birth as well. It was always kind of the main focus is on mum, which is obviously needs to be there, but then there wasn't any kind of sidelong. And I remember being in a lot of rooms kind of very, very worried, having lots of questions and not feeling like I was really invited to share any of that at some points. So sometimes feeling like I need to push my way in here a little bit because I want to get some answers. And then sometimes well received, sometimes it was a bit tricky. But every time that I did feel quite invited into a discussion of things, that always made me feel really well included. But it was there's only a few times I can really think that ever happened for me.
Thank you. And I think that's really key about feeling able to and invited, and having to actually feel like you need to be invited, and not having that voice to know that actually I do have a right to ask questions, and you're holding that worry and concern and anxiety, and not feeling like the professionals are inviting you to ask those questions. Thank you for sharing that. Andy, do you want to give any thoughts on that?
Yeah, same, to be honest. I think what kind of encouraged me to be a bit more pushy to kind of invite myself into those conversations when I felt boxed out was because I had to take those stories to my circle, to my friends outside. Oh, oh, how's the child doing? Or what's happening? And if I had no answers, I just felt really silly. So I felt, empowered to kind of push through those conversations. So whenever the health visitor came around, so I would jump in and say, "Hi, I'm Andy. How are you? Welcome back." I'll genuinely have to force myself into get that information. So whenever I went back to my conversations or my unit, my support system outside of, the home, I could kind of have some content for my friends and family. But
Thank you for sharing that. And just on that note, just want to go back into some of the scenes in the film, thinking about some of a particular scene and some of the scenes where the father in the film was having intrusive thoughts and fears. And for me, it was really powerful because I've had conversations with fathers in my family where I know particular members of my family don't hold babies. And I always thought that was it a culture thing? And I think there was some element of that. But then just after watching Invisible, I had a conversation with a father, and they said, yes, they had certain thoughts, and that's what stopped them from actually taking an active role. And as a mother, I would have never thought about that. And it's just watching the film that made me think about that. So I just want to ask you both as fathers, around what we saw in the film, around the intrusive thoughts and the fears, how common would you say they are, these silent worries amongst the fathers, from your own experience or from fathers you've spoken to?
I remember watching the video and oh, sorry, Nana.
I can hear you.
Okay.
Yeah,
I
yeah.
remember watching the video and the two scenes where the dad drops the baby. Um, I remember looking behind me thinking, oh my God, like I've had that before because it's something that is quite precious and you just don't want to get it wrong. You don't want to, walking up a staircase or whatever, all of these kind of things I think is very, very common. I've had them thoughts of, am I doing enough? Am I going to be good enough? What about me? Is this child going to pick up that is gonna, give them a traumatic experience at life. That there are loads of things, there are loads of kind of worries that pop into my mind. I do have a great circle of people. During the pandemic, we set up, myself and a group of friends set up a fatherhood group, where we meet every Sunday, and we communicate with each other. So some of these intrusive thoughts, which seem quite abnormal outside of, in the real world, in our circle of maybe 15, 20 members, we're able to share this. Guys, I felt this today, Oh, really? Okay, tell us a bit more about it. And we're able to unpick it to help each other out. But yeah,
Thank
totally
you.
normal. Very
Thank
common.
you for sharing that. And I think it's great that it sounds like you've got a great support circle of fathers that you're able to have those conversations, and just thinking about and reflecting on some of the conversations, fathers who don't have that support network and that system, how challenging that could be for them. Can maybe touch on it later around thinking about networks when we speak to the wider panel around spaces that other fathers can link into. Dylan, do you want to share any experiences or thoughts around that scene?
Yeah, that scene, when I saw that, my heart dropped. I wasn't expecting it. So I think it's a really good way of yeah, visualizing what those intrusive thoughts look like, because it just feels like it's happening. But I mean, yeah, for me, I didn't have those kind of specific experiences, but then I don't know. I think it's all like a sliding scale of experiences. I had really vivid worries that when I was holding my child, that things would just break around me. Like I couldn't sit on the chair because the chair's going to collapse. So like it's weird, like how you have these thoughts just come to you. I think it's that like protective part of your brain. But then how do you talk about that with other people who don't know what that's like? And I remember talking about it with some people sometimes, and I intentionally kind of made it a little jokey, but then they would just kind of see it as that and then move on. And I was like, I kind of maybe wanted to communicate that a little bit further, but wasn't sure kind of how to talk about it because it's not like a conversation I've had before. The first time doing this, and it's trying to figure that out, I guess. But yeah, I agree. I think it's quite common
Yeah.
experience. Yeah.
Thank you. Thank you for sharing. I think the last question I'll ask you both, and then I'll move on, is around culture and traditions. In terms of culture and tradition, I think that plays an important role in how fatherhood can be understood. And how, I mean, from both of you, how do you feel culture shapes the way fathers are supported? And from your personal interactions with professionals, either midwife, health visitors, or even GPs, through the maternity process and postnatal, what has been your experience of them showing understanding and respect for your individual cultures and um, your traditions within your home? Dylan, shall I come to you? Then we'll go.
Okay, you're asking the easy questions. I'm quite stuck by that question because I don't know. I think my experiences have been too few to really say that they've treated me in a
Yeah,
specific way
yeah,
related to
yeah.
culture. It's quite hard to pull out from what I've experienced. I think people probably just kind of make an assumption about me or something.
Mm.
Yeah, I'm not sure. Sorry.
Yeah, and I think when we say culture, it is about in terms of how you are, how your home, I always say your personal culture, how you are as a
Mm,
person in your home, and when you go to
yeah.
appointments, going with your partner to appointments, or when a health visitor or a health professional comes into your home and how they see you, or as you're saying
Mm,
that certain people can make assumptions and take the
yeah.
conversation or treat you in a certain way because of those assumptions.
Yeah. Yeah.
Okay, thank you. Andy?
Yeah, so I'm from Ghanaian background, and I think, fatherhood is supposed to represent provider, authority in a home, that kind of thing. Lack of emotional presence. So that's always been what things have been culturally. Dad wasn't like, "Oh, I love you, son," or "Give me a hug," or all these kind of things, or "I love yous" and what have you. So typically that's not been what I've grown up with. For me, my culture, silence does not mean disinterested. It just means you're just taking in information. So I sometimes could find that in the appointments, if I'm just quiet, taking in the information. Okay, all right, this is what's happening. I'm making mental notes. Or I'm writing on my phone, things that I can go online and research. It just looks like, all right, he's just on his phone. He's not present. But then we leave the meeting or whatever, and I've got all the information and I'm able to call my medical friends and find out what does this mean? How can we, so that I'd go back to the appointment a bit more well versed or well knowledged in terms of the information that I need. But yeah, I haven't experienced any negative interactions with professionals when it comes to my culture and boundaries. It's just been a lot more internal stuff for me of how I show up differently to how I've seen things done from my upbringing. So that's what I would say.
Yeah, I think it's also hearing for the professionals listening the positives, what they need to do more of, because it's not always about the negatives. Because I think there's some really good practice out there. So, in your responses, please do share any positive experiences
I
as
would
well.
say
So
I
thank
would say there was maybe a time I think after my second child was born, my mum had passed away. And so it was very interesting to see that the health visitor was very observant.
you.
So being observant is also very, very key. Like reading the room, for example, when the man was sitting on the sofa and her visitor asked, "How about you?" And then she was interrupted with a telephone. She should have just gone right back because clearly he had a crazy or interesting experience of the birth, and it was kind of manifesting in his face. So if you're a bit more observant as a person, you could read that this guy's not okay. Can I speak to you quietly at the end or whatever? Just show a bit more interest. So during my second born, it was a case of, oh, how are you? No, really, how are you doing?
Mm.
She knew that I was going through some emotional breakdown or something, but she was able to kind of unpick it and just obviously I didn't disclose it to her, but I was grateful that I felt seen in that moment.
Thank you for sharing that. Thank you.
And,
Now, oh, Dylan,
oh, sorry.
please.
I was just going to say, I mean, I haven't got any really positive ones I can mention for professionals, but I do want to kind of stress how helpful joining a father's social group has been, and
Mm,
how like much that's allowed me to be seen and kind of explore some of these ideas around fatherhood. And I've
yeah.
really enjoyed that. That's been a really beneficial thing.
That peer support.
Yeah,
Thank you for
yeah.
sharing that. Um, Now let's move on to you, Chris, the creative person behind the scenes. So I just want to ask you in creating Invisible, what did you hope it? I mean, lots of your films, I'm a great admirer of your films, is around creating that shift and that change and hearing the voices of the unseen, and getting those messages across. So when you created Invisible on together with Sharon with on the back of the research, what did you hope it would change, and what did you want people to see, and how to change in terms of supporting fathers?
Um, well, I suppose, I mean, I was looking for the film to have real impact, to make people think differently about fathers. And I think that's what I try and do in most of my films is when you have a particular patient pathway, there may be certain assumptions that you have about that individual when, if you realize that there's actually probably a lot more going on for that individual, to see beyond the person that's just in front of you, to kind of realize that actually they might have a load of experience, a load of stuff that's going on, that they're not presenting to you. And I think that's the case for every encounter we have. People bring their own experiences to it. And if I think back on the research, one of the main insights of the film was that the really severe cases where there are really severe mental decline, which in some cases can lead to suicidal ideation, it's really those individuals where there might be some kind of unresolved trauma or some kind of unresolved mental health issue in their background. And then you kind of have this moment of complete, a life-changing moment where a new child is brought into your life and it triggers it. It triggers that moment. it triggers it, and it kind of manifests itself then. And so all those unresolved issues come to the fore. And that was the kind of thing that really came through in the research. And so I suppose I wanted viewers, and I wanted to health visitors to be able to watch this film and sort of understand that there might be a whole load of stuff going on for that person. And if we saw in the film, you know, the main character was very good at concealing it. He was very good at concealing it. And he, in the way that he was dealing with his own sort of mental unease, was to really express his masculinity, which was another sort of dimension of the research through reading Sharin's research and also the interviews that I did, that this is very much about masculinity. This is very much about what is the role that I have? What is the role that I can play here? And that sort of sense of, I will do the masculine thing. I will be the provider. I will be the one who does all the stuff that doesn't involve that sort of direct childcare, becomes almost a coping mechanism. As we see in the film, that is a kind of a coping mechanism for him. I mean, we very deliberately created a character that didn't in any way on the face of it need to find somewhere else to live. It was very clear he could stay there in that house. It was a very comfortable house, and he knew that he wasn't going to have to pay any rent or anything. It was an obvious thing for him to stay there. But we wanted to put pressure on that character, an internal pressure, which they're kind of bringing to the whole experience, which is, I need to prove myself here, and I'm going to go out. I'm going to be the one who brings the money in. I'm going to be the one that's going to sort this out. And ultimately, you know, it leads to a major decline in his mental health.
Yeah, thank you for sharing that. And I think I mean, the next question, I think you've answered it in a way, but I just thinking about some of the scenes in the film, just want you to expand a bit more on just thinking about Invisible as a film gives us a powerful window into a father's inner world and thoughts and emotions. And I think it does that so amazingly. And a lot of these thoughts are misunderstood or hidden, especially when you've got professionals who may see a family, a parent for just 5, 10 minutes, 15 minutes. So from your perspective as a filmmaker, what creative choices did you make to help the audience? And I'm just thinking about the professionals who would watch this film to feel and empathize with those unseen struggles to be able to reflect on in their practice.
Well, I think the scene that I suppose a lot of people talk about is the baby drop, you know, particularly the first baby drop. And I think that came across, that we wanted to include that because so many fathers that we spoke to did talk about these intrusive thoughts. And actually the intrusive thoughts that were expressed to me were actually a lot more severe than just dropping a baby. They were like really, really shocking. And, you know, the fathers I spoke to who shared it, you know, they shared it with real honesty, and all credit to them, because these intrusive thoughts, and I think, Andy, you touched on this, by the very nature of them, you're not going to share them because they're things that you don't want to be talking about. You don't want to admit that you've had these thoughts. And it's quite interesting, actually, as a result of a few people watching these films, the film, a story was recounted to me. It was actually a mother who recounted this story, and she talked about how she had lots of really bad intrusive thoughts, and was convinced herself that she was evil. She had convinced herself that she in some way was an evil and a bad person, and she was for the first time, having watched the film and seen that moment, felt that she could talk about it. And so there is an element of breaking the silence here, you know, about intrusive thoughts, because I think we all at some point in our lives have had intrusive thoughts of some description, and as I said, by the very nature of them, you know, you're not going to talk about them. So I think that was the baby drop was one that we really thought about, and interestingly, I don't know whether you noticed, but we actually did some visual effects on the baby. So the baby, even though the baby's a prosthetic baby on the wide shot, you can see the legs moving and So the impact of it is quite extreme. Certainly the first one. And I think it's just a broad point. You know, what you're trying to do with this film is you're trying to enter into the mind of that individual. You're trying to show that person, particularly in this case, is kind of like on the periphery, and it's things that Dylan and Andy have already picked up on. Is that you're kind of almost a little bit of a spectator, and so we try to kind of convey that as much as possible from a sort of creative perspective. But I think fundamentally, this film is based on lived experience from the research that Sharon's done, through people I've spoken to. Everything that you've seen in that film has been influenced by what we've been told by other people, down to the gambling. That was that was based on one particular story. And that his particular story was, he got to the point where he couldn't cope, and he basically gave himself an ultimatum, i.e. this bet either comes in or I kill myself. And the bet didn't come in, and he did try and kill himself. So, you know, this and that he very, you know, he shared that story, and he does share that story in a public arena as well. It's great that he shared that, because I think, you know, it's on the extreme case, but I think, you know, that is the harsh reality, that you just don't know what's in front of you. You just don't know what's in front of you.
Thank you so much. Yeah, the baby drop, and I think that point around the intrusive thoughts, it's for both mothers and fathers. I think that's a whole nother conversation for another day, but it's very real and needs some space to be unpicked and thought about. Thank you. Just conscious of time, so I'm going to move on to Dickon. It'll be really helpful for you to share, just thinking about your experience and the work you do around and thinking about how professionals can use, I've seen a question in the Q&A as well about mentalization approach to help us understand the thoughts and feelings and intentions that lie beneath the behavior and presentations we see, particularly when fathers' inner experiences might not be directly spoken about. Is a very loaded question, and I know with mentalization you can't just talk about it on a whim, and people need to have those fundamental understanding of mentalization, but if possible at a very basic level, or level that professionals listening in could actually just start to understand. And obviously we have lots of opportunities and webinars and training at Anna Freud people can log on to and listen into and get further understanding. But if you can share any helpful thoughts, will be helpful.
Yeah, I mean, first, thank you, Chris. It was a great film, really moving. And it's a great title, Invisible. And I think when you think about fathers being not seen is important. I mean, it's a much better title than the one I would have come up, which would be, rather than using the word invisible, I'd have said unmentalized, that nobody was making sense of this young father with his particular cultural expectations on what fatherhood must mean, with his personal history, fearing perhaps that he's going to become what we can assume was an abusive or neglectful father in his own life. And that what we saw was a kind of long telling of a story of a mind that felt itself completely not understood, not seen, not made sense of in terms of his context, which is becoming a new father. And that's really around this notion of mentalizing. It's a word that sets some people's nerves jangling, because it does sound rather techno and techie. And in fact, it's something that fathers, mothers, all of us do without having to think too much about it most of the time. And it really is that making sense of human behavior on the basis of imagining what might be going on in the mind underneath that behavior, in terms of the hopes, the beliefs, the assumptions, the intentions, the fears. And in order to get our own mind into the state of mind that can do that kind of thinking, which is different from the kind of thinking you'd want to do if a tiger was walking into the room. You wouldn't want to mentalize the tiger. Mentalizing is a slow kind of approximating, guessing, knowing, if you like, that I don't know what's in this father's mind, but it would sure enrich me to know better and to understand how to make sense of his distress. So mentalizing is a state of mind that we can get into, but generally when we're calm. Becoming a new father. I'm a father of 3. They're now old enough for me to say it wasn't very calm around certainly the births of all 3, but certainly in those early months too. And our brains have evolved quite uniquely with humans to be able to make sense of one another and ourselves, because I can mentalize you, trying to make sense of you, but I can also rock back, if you like, and mentalize myself. Why am I feeling like this? And what we saw in this father was really both him falling out of his mentalizing balance into states of mind that are useful in the right place, but very unhelpful in the wrong situation. So he was becoming very certain about things. I'm definitely going to turn into my own father. I must move the family into a house now, which, as we've already heard, was, well, we could see from the outside that wasn't the case. And then perhaps into action. The solution is to win a load of money by gambling, to go back into a thing. The solution is to end my life. That's a sort of, if you like, a non-mentalizing. It's a kind of solution by action. Of course, sometimes action's a useful thing. If a tiger's in the room, you kind of want to run away, not mentalize it. Yeah. And I think that what we saw in the film was, and why I really liked that notion of sort of invisibility. I just want to kind of, why I would bring back mentalizing into that is that, of course, to be seen, we're not talking about being seen with our eyes. It's to be seen sort of on the inside. And one of our definitions of mentalizing is to see oneself as others see us, and to see others as they see themselves. So there's a lot about seeing, but I just want to be very clear. It's plenty of incredibly obvious and powerful evidence. If you're blind, you can still mentalize. So it's not actually about seeing. It's that kind of inner vision, if you like. And mentalizing is kind of a word that gets us into that thing, because we make sense of behavior on the basis that the person behaving in this way, myself or you, is mental. Yeah, and we're all mental. The opposite of mental, remember, is not sane. The opposite of mental is mindless. So to mentalize someone is to treat them seriously as though they have a mind, which I don't know and can't know. So it's not mind reading, it's the opposite. It's kind of, if you like, getting less bad at mind estimating and having that ability to lean in to those moments of possibility. And we saw a beautiful example of that towards the end of the film, when the health visitor initially kind of got it wrong in a perfectly innocent way, invited the father to hold the baby, noticed his frozen sort of fear, and she shifted. And how she did that, she didn't have to think about it too much, but she mentalized the father that actually some different way of him making contact. Why don't you let the baby hold your finger? And that was this kind of shifting point where somebody did see this father and saw him in a way that he was enabled to feel sort of recognized, really. And one hopes that was the beginning of some different ending to the story as it might have gone. So I suppose that's kind of what we're about. And of course, what's a father's role? Well, mentalizing doesn't arrive just because I have the lump of brain that does it. Call it the prefrontal cortex. A baby learns to mentalize by being mentalized by the people closest to it. So obviously we mostly think about the mother, but here we're very much reminding ourselves that babies, it's very important for them to have multiple perspectives on their mind. And how it happens is the baby makes an expression, a kind of little cry like that, and the mother will recognize it and almost without having to think about it will imitate that back, and show the baby, if you like, a picture of how she has imagined the baby's might be. Oh, are you a bit sad? Oh, are you a bit frightened? Oh, that's fun. And she's showing in her face, in her tone of voice, her estimation of what's happening in the baby's mind and why they might be behaving like that. And if the baby gets this minute by minute, hour by hour, not just from mum, but from dad, from grandmothers, from everyone around them, that's how they start to build an idea of themselves, what we call an agent self, a self who can operate out into the world and kind of, if you like, think. So we learn to mentalize by being mentalized. And we've already said, I said earlier, this is a time of life where there's a lot of stress, and stress kills our mentalizing, knocks it out often. And how we get it back as adults is to have other minds that mentalize us. So mentalizing is really a social phenomenon as much as a psychological one. And it's important that you think about that when you think about the role of a father, because a mother will struggle to mentalize her baby at times, but having a husband or a partner who can mentalize her in her exhaustion, her fear, will help her to kind of go, okay, I'm not going crazy. So just as for the father, somebody mentalizing him in his difficult moment helped him to kind of start to mentalize the baby. So fathers, if they have the network around them, can help mothers and vice versa. So thinking about mentalizing as a social phenomenon as much as it is a psychological one is really critical.
Thank you so much, Dick, and you did a great job of trying to put that into one. I really appreciate it. I just want to acknowledge that we are going to run over time. So thank you. I know it's late in the day, so those who have to jump off, you will receive the recording, but just to give the conversation the space it needs and to be able to finalize and close things down safely, we will run to around 6:10. So for those who have to jump off, thank you so much for joining, and those who are able to stay, please do stay, and we will send the recording through. But thank you so much, Dick. And I'm just thinking about what you just said about mentalizing and the impact of stress on mental and being the ability to mentalize. I just want to actually ask Sharin a question from yourself as a practice, from your experience of when you were practicing as a health visitor, and just generally as professionals. We all know services are so stretched at the moment, and we have to make every contact count. And some contacts is literally 5 minutes in, 5 minutes out. But when you're hearing examples of how Dickon has explained the process of mentalization, and hearing from our fathers, Dylan and Andy, their experiences, how would you say, for the professionals listening in, how can we meaningfully apply that reflection, curiosity within the time constraints that we have as professionals?
Yeah, no, interesting question, because the reality is we're all working under pressure at the moment, and that's the reality. I would say that being curious and asking fathers about how they're doing doesn't really require additional time. So it's more about how you use the time you do have effectively. So something that Andy said earlier, that when the health visitor visits, for example, he makes himself known. He says hello to the health visitor and he joins in the conversation. But I think if that can happen from the other side as well, where health professionals and practitioners are involving fathers right from the beginning, then that would really make a difference. So it's about how do you use the time you have effectively. And I think that one of the biggest barriers with working with fathers is often they're not present when we're doing visits. So as a health visitor, when I used to do home visits, often fathers weren't there, they would be at work. So I think it's about going back to the basics and making sure when you're sending out invites, you're making those appointments, let the parents know it's for the mother and father. It's not just for the mother. Because a lot of men don't actually realize that midwives, health visitors, people who are working in the perinatal space can work with fathers too. Because traditionally it used to be a service for mothers, and a lot of fathers think that's the case. So it's about inviting both parents. And we know from some work done in health visiting that when fathers are exclusively invited, they do attend, they will make time and they will be there. So it's starting right from the antenatal period, making sure fathers know about the important role they play in the child's life. So it's from inviting them to appointments, involving them, but also asking them direct questions about their own well-being. Because one of the things we find is that when we work with mothers, we address their needs, mothers' needs as mothers, but also women in their own right. But when it comes to fathers, we need to do the same. We shouldn't just see fathers as an extension of the family. We need to address their needs as men in their own right. And I think these are the changes we need to make. So there's something about changing the way we work, our mindset, and just being curious. Ask questions, ask direct questions, because when you do ask, you will get the answers. And the other thing to say is don't make assumptions, because there's a lot of assumptions around men, that men won't talk about their mental health. This is not something men like to talk about. And what I found in my study was that men said if they were asked direct questions, they would give direct answers. So it's about asking. Don't hesitate, don't make assumptions. And each person will be different. Don't make assumptions that everyone's the same. So I think it's about having that curiosity, asking those direct questions, inviting them to appointments, and also reflecting on your own practice and think, have I done a good job? Am I missing anything? Is there anything else I could have done? And am I providing individualized care for that family? So yeah, it's all of these things really. So I think it all can be done. It all can be done in the time we have.
Thank you. And we know it can be done because we're hearing positive stories and it is being done, and really appreciate those words of wisdom. And I think it just highlights, it sometimes is, as professionals, we sometimes overcomplicate things, and it's sometimes just a simple going back to human basics. And I really love the point you raised around inviting fathers, because I've had that experience with my husband where, oh, it's just for you. And no, it's for both of us. But if they're not specifically invited, he'll just think, oh, it's Nana just wanted me to come along. So I think that's something that as professionals, it's really important. Even when we're working with young people in clinics and we want to see the family, make sure you invite the named, if there's the two parents or one parent or aunt, whoever's involved with that child, actively inviting them so they know they are part of it. Thank you so much. I'm going to wrap up now, round up. We can go on for a whole hour, just unpicking what we saw in the film, the research, and some of what's been shared already. And I know it's really unfortunate we don't have the time to go through the questions, but what we will do is we'll collate all the questions and then respond to them. And I can see some really helpful reflections and thoughts in the chat. And yes, the film, I can see some people have shared that the film did make them feel sad and emotional. And it's real. And as professionals, I think it's important. And I think that's the power of creativity and film, to really remind us as professionals, when we unpick and remove all the layers of the bureaucracy and everything we have to do and actually we're working with real human beings and people and feelings. And so before we close, I just want to go around the panel. Does anyone want to share any final words before I wrap up? No? Okay. No? Okay. I'm going to wrap up then.
I'm just going to say,
yes.
I mean, from my point of view, the film is freely available with the briefing notes, so please share it widely, because we want to make sure as many people can benefit from it as possible. And so parents, practitioners, so please do share it freely.
Thank you.
Nana?
Yes.
I wanted to say, no, thank you very much thank you to Chris Sharin for creating this amazing piece of work. It just adds to the fact that, men or fathers are being heard, we're being seen, and it's just like the beginnings of the journey of, this amazing time in history or in the future to come where there's equality, where it is about the woman, is about the mother, but it also isn't forgetting the struggles or the silent voice of the father. So I just want to say thank you very much for allowing me to be part of this. Thank you.
Thank you. Anyone else? Okay. All right. So
maybe Nana, just a word about when we work across difference, and just to kind of come back to that, because of course in every human interaction we work across difference, but some differences are much more potentially make those interactions more difficult. And I think one of the things I left out of when I was talking a little bit about mentalizing is you don't mentalize out of a vacuum or out of a sort of cloud. You can only mentalize from your own position. In my case, an aging white-haired white man. And if you like, if you can't imagine what the impact of your difference might be on the person in front of you, it's very hard to actually mentalize them. So I think, if you like, my understanding of this part of the brain that does mentalizing is that it was evolution's answer to some extent about kind of transcultural interaction. How do I make sense of this person who's behaving differently from I might expect without us resorting to kind of violence or abuse or something? How do I lean in to understand that difference? And I think that that's, if you like, at the heart of what we're talking about when we're talking about fathers, perhaps particularly for professionals who've focused a lot of their work quite understandably on mothers. Fathers are a slightly separate group and need some of that leaning in, regardless of what other kind of differences in terms of all the social graces that John Burnham talks about.
Thank you so much, Dickon. Thank you. So before we close, I just want to say a massive thank you to everyone who signed in and listened in. And I'm really sorry we haven't been able to go through all the questions. As I said, we'll go through the questions and share responses after the event. And I want to say a particular big thank you to Dylan and Andy, our parent champions. Really appreciate your honesty. And it's not always easy sharing what you have shared and thinking about the film we watched. And obviously, for some of the reflections, it may have triggered some experiences or thoughts you may have had. So I really appreciate your contribution and your honesty. And Dickon as well, thank you so much. And Sharon and Chris, thank you. Seriously, I was at the Father's Day launch and the screening, and I still watch the film and I still jump at certain scenes and still learn something each time as a mother and as a professional. And I would urge everyone listening in, as professionals, please do share the film and the resources that accompany the film, not just as amongst your peers, but with fathers and mothers, families. I've done that personally, and it's generated some really helpful conversations and discussions and thoughts around what was in the film. What we've explored today isn't only just about individual fathers, it's about the system that determine whether fathers are seen and supported and valued. And whether it's 5 minutes or 50 minutes, there's always a moment to pause and be curious and to mentalize, to hold in mind that what might be happening beneath the surface is really important, is the simple things. And the film we watched today was called Invisible. So let it remind us of our shared responsibility to build systems and services and professional cultures where no parent, no child, no adult feels invisible. And I think that also goes across us as peers, as professionals as well, because that communication and that sharing, learning and conversations across, so no one should feel invisible across the system. So before we close, I want to repeat the earlier warning sign around the trigger. So what may have been discussed today, plus what was viewed in the film, might be distressing and triggering. So please do use the link with resources that you can contact for support. And as I said earlier, today's webinar will be available to rewatch and share via the Anna Freud YouTube. And resources are also available on the Anna Freud website. And are there other webinars and training available on the Anna Freud website as well? And also please visit the Institute of Health Visiting website, where aside from the resources and the film Invisible, there's a multitude of resources and helpful information for all those of us working in early years with children and young people. And on behalf of all of us at Anna Freud, I want to thank you all for joining and for your commitment to supporting children and families. Thank you all. Thank you.